Annual enrollment still going on, and that means that a lot of families, a lot of seniors could be looking to possibly change their doctors this time of year. Well, what do you need to know? Thankfully, James DeBray is back with the MyCare Medical team. This is what they are so passionate about, making sure that people are making the best decisions for them. Frankly, when it comes to healthcare, it probably is one of the most important decisions you're ever going to make. And now is the time to make those. So, James, good morning. Good to see you.
Good morning. Thank you for having me again.
I love that the MyCare Medical team is really making sure that you're putting everybody as safely as you can kind of out there and encouraging people to ask questions and to come out, meet the doctor. What do you want people to know this morning as we kind of inch closer to the really kind of peak of annual enrollment?
Yes, I'm going to continue to reinforce my point that, you really want to spend some time getting to know your doctors that they're going to service you and serve you. And you really want to know that they're going to make a plan that's customized to your health needs, and you have a care plan that's very specific to you. That, and then secondly, you're going to want to make sure that you can be part of the care plan team. And that is, they will consult with you and seek some counsel from you in terms of how you can best be compliant with the plan that they put forward for you. Those things are vitally important, as well as just you also want to meet the staff and make sure it's a friendly and inviting environment.
Well, and it's so interesting. We've talked about this where it's not just necessarily the doctor, that obviously you need to make sure you have a good relationship with the doctor, but it's the whole team. It's the people working behind the scenes. It's the facility that you're going to. You want to make sure you go to a right facility. I mean, these are all things that people need to be reminded, and not only the seniors, but their caretakers as well, that these are things you should be looking for.
Oh, absolutely. Beyond the doctor, there's a whole support team behind him or her that's actually making sure that for the patient, it's a seamless engagement, that they come in, their appointment is handled on time, that the doctor is there on time for them to engage in, that there's a prescription and a referral program that's in place. So as they're exiting, they can get a referral to see the specialist they need to see, that they can pick up a prescription, and that someone's checking on them as they exit to say, hey, how did this engagement go? Did everything go to your liking? Are you satisfied with what happened today? Because not only are you there for your health, you're there to make sure that the experience is one that's enriching for you, and that you feel like, because of the experience, I will continue to come back and make sure I maintain compliance with my health plan.
Talk about that first visit and what people should maybe look for. And I mean, really, and again, I think it's so nice that you're encouraging people to ask questions, because I think sometimes we feel bad, like that we're kind of grilling them and putting them on the test, but it's important to do.
It's very important to do. I mean, for the first visit, one of the best things you can do for yourself is to bring along all your prescriptions, so that the doctor, that he or she can actually look at your prescriptions as they're looking at your health plan and saying how we can see how these prescriptions either interact, enhance, or take away from one another, and so that we can maximize that prescription for you. Also, come prepared with a lot of answers, because you're going to get a lot of questions about your medical history. The best way for them to build a better plan for you is to make sure that they understand your history. And that's how they build a customized plan. What is it that you do? What time do you get up in the morning? What time you go to bed? How you're feeling at night? How's your rest going? Are you sleeping well? Are you not sleeping well? Do you have anxiety? How you're dealing with COVID? All those things are actually part of the care plan as the doctor builds a plan for you.
We've had a chance to meet some of your doctors and hear their stories about kind of that, the rewarding kind of benefit of this and helping so many patients. Do you see that as well?
Oh, yes. I see it. And it's probably the most rewarding thing that I ever experienced. I'll give you an example of a lady. She was not even a patient of ours, but when the COVID first hit, we gave out care packages to all the senior living facilities and all the seniors that we ran into, because we knew that they needed cleaning supplies, they needed food, and they were afraid to go out. And so personally delivered one to a lady. And about 2 weeks later, we ran into each other at one of my medical centers. And she said, I joined because of the care package and the gift that you gave to me. And it told me this is the place that I want to be. So that was probably one of my most recent rewarding experiences from a patient.
That's awesome.
Yeah, it's very good.
Hey, you guys really have been out there in the community and making sure that people know where to find you. You've been having these events every couple of days, at least once a week.
Yes.
How are those been going? And then tell us where the next one is.
Yeah, they are going very well. We recognize that food insecurity is just a big, big deal. And people trying to decide between paying rent and picking up their medicine or buying groceries is always something that tugs at our heart. And so what we're doing is we're providing food pantries in a lot of different areas. The next one we're going to be, it's going to be November 12th. It's going to be from 12 to 2 at the Ark of Hudson, which is on 12052 US 19 in Bayonet Point, Florida. And so please come out. They'll have bags of food for you. You can meet some of our team and our staff. You can learn about our facility, but more importantly, you can relieve some anxiety in terms of trying to make a decision between getting food and making some other decision.
Well, again, MyCare Medical offices all across the Bay Area, which is so nice. There's the website, the number to call if you have any questions. James, as always, thank you so much. We really appreciate your time. We know how busy you are these days.
No, thank you. Glad to be here.